Hi, everybody. Thanks for hanging out with us again here live with the Goshen Chamber of Commerce. And I am hanging out with a member. Her name is Dr. Ericka Valenzuela. She's with the WeCare Medical Office in Pine Bush. And we wanted to kind of talk about the business of health. She is doing things very different, very innovative, and it would be great to have some insight from the doctor. So without further ado, I'm going to bring her on the screen with us, and we're going to start learning with WeCare Medical Office.
Hi, Barbara.
Hi, welcome.
Thank you for having me. I'm very excited to share about, direct primary care at WeCare Medical. Thanks for having me.
Thank you. So, you're a doctor, and there's a lot going on. So let's get started with your background. Tell us a little bit about WeCare, about why you became a doctor, and what you're doing now, this direction that you've taken.
Yeah, sure. So I was actually exposed to the medical field when I was young. My mom went to nursing school when I was little, and so I was really fascinated by all of the books that she had around me, and anatomy, all the pictures of the body. It actually didn't gross me out looking at books with skin diseases, and it was actually quite fascinating for me. And so naturally in school, I gravitated towards the sciences, and then I looked into the medical field. I started spending time in medical offices at the hospital, and I loved it. And I thought, okay, this is really what I want to do. And I'm really happy I went into the medical field because I do feel that it really fits me very well. I enjoy really taking care of people, and also having grown up in Germany, where the medical field actually has a little bit of a different slant to not just pharmaceuticals, but also looking at the whole body. There's a lot of homeopathy that goes on in Germany, and just, more what we call here integrative medical care. And that's really my approach. And so I went to medical school in 2000. I went to Kansas City Medical University of Biosciences, and then finished my residency in family practice in 2007. And I started practicing in a community health clinic, really helping out the underserved, uninsured population in North Carolina, which is where I finished my residency. And there were a lot of migrant communities to help out with, that would come to North Carolina with helping all the farmers with all that work. And so they obviously didn't really have insurance, and they also couldn't afford to just go to any medical office because of the expense. And so I really loved helping that community because access to healthcare has always been really important to me. And I feel like that has always been a drive for me to, and why I'm in primary care, especially because I generally feel that a primary care physician is where, healthcare starts in the family. And so that was very rewarding, working with them in that community health clinic, being able to see the babies, adult care, geriatric care. We did home visits back then too. We did acute care, taking care of the sick, and also dealing with all of the chronic medical problems, and then talking about preventative care, doing gynecology. I mean, that's really what a family doctor does.
So you do everything, different age groups, you can handle all of that.
Yes. Yes, and that is really why I love family practice. But the longer I've been practicing medicine, the more, we're really put into a role where we just see adults, and then all the specialties will see the other things, right? The pediatrician sees the children, the gynecology sees the gynecology, but they really, help us to deal with some of the more complicated cases. But primary care doctors are trained to see the general, pediatric well child, the sick pediatric patient care, the gynecology. We're trained in everything, really, a little bit of everything. And then when things get a little bit complicated, then that's when we utilize the specialty physicians. And so that the fact that I've had to, so for the past 15 years, I've struggled with trying to practice like a true physician. And also in the last 15 years, I've also noticed, the traditional fee-for-service model putting so many restrictions on both parties, the patients and the physicians, has been very frustrating. From a physician point of view, we're expected to see a high number of patients in a day. So averaging, 24, 25, 26 patients a day, which, really it creates that churn and burn model, to see patients after patient after patient. And it's really taking away that personal relationship that we used to have, right, with our family doctor when we were growing up, right? We felt like we had the time to talk to our family doctor. We had that trust in our family doctor. We could go to them for anything that we needed. But now it's really more of, you have 10 minutes to speak with the doctor, and, I hope you get all your questions answered. But if you don't, we're going to have to set up another visit. And I'm really sorry that's the way it is, but I have to keep going because otherwise I'm going to fall behind. And as it is, all of us fall behind in the traditional healthcare system because we're expected to see so many patients, right? From the patient point of view, in the traditional healthcare model, right, the access to a primary doctor is very difficult. So there's been some studies that have shown average time to get into a primary care doctor, it takes about 24 days, so about 3 weeks to get an appointment with a primary doctor. And then when you actually get to the doctor, then you wait about average 120 minutes to then only see your doctor for maybe 10, 15 minutes.
Mm-hmm.
That's very disappointing for a patient, very frustrating for also the busy patient that works, right, to take all that time. And then within 10, 15 minutes, how much can you really accomplish? How much trust can you really develop with your doctor? And so, really that struggle is what we're faced with right now in this current healthcare model in 2020. And so after 15 years, I ended up going to a medical conference where I found out about direct primary care. And I thought, oh my goodness, I can't believe this has been around for 10 years. Where have I been the last 10 years? So I started looking into direct primary care, and it's been really amazing for me, physician, and for patients.
So it clicked. Direct primary care, you said, this is exactly what I am looking for. This is what I want to do, and I want to bring this as part of the practice that I offer. I know for a lot of businesses, especially small businesses, they have a hard time affording healthcare. So a business owner that is a small business sometimes forgoes having medical insurance or healthcare insurance because they just can't afford it.
Right.
Talk to us a little bit about the affordability of this program and why it's important for businesses like a small business that have a hard time being able to afford healthcare to maybe explore still being able to take care of themselves.
Correct. Yeah. And I'm so glad you brought that up because that's also another limiting factor of why right now in the current healthcare model, people are not accessing their primary care doctor. And instead, they're really just seeking urgent care or going to the emergency room for medication refills, which, is very frustrating for everybody involved. But with this model, we actually just offer a direct relationship with our patient. We take out the third party interference, which is the insurance companies. And so that way we then with just a membership model for healthcare, so our patients pay us directly via a monthly membership. We then we're able to then spend more time with the patient in order to care for all of their healthcare needs. So really with direct primary care, via this membership model, which at WeCare Medical we offer for adults, it's $79 a month, and for children it's $39 a month. And then, for businesses, we offer different packages based on how many employees they want to sign up. And for families, we have special programs as well. But basically what it comes down to, by having eliminated that third party interference, we then can focus on, seeing our patients making appointments available. We promise our patients same day or next day appointments, and we also offer extended appointments. Most of our appointments are a minimum of 30 minutes. New patients are actually 1 hour appointments. So that way we really take the time to get to know each other and understand what needs to be done to get them to better health.
So tell us a little bit more about direct primary care, and also tell us about, I like the idea, I was talking to your office manager, and he mentioned home visits, like the traditional,
Yeah.
I thought that was just such a great, like going back to basics, back to what medicine used to be.
Exactly. And that's really why I went into medicine, right? Because that's the family doctor that we used to know, and it was a friend of the family, really, right? And so that's really what I want to be for all of my patients. And so yes, I went back to that traditional model by offering home visits, especially for our newborn babies, our new moms. It's really such a cumbersome it's really very challenging to get a mom to bring their newborn baby within, for that first newborn visit for the first 3 months, really. And so I offer, instead of them coming into the office, for me to actually go visit them at home. Also for, those that are very sick, the elderly, if they're dealing with the flu, for instance, right? I don't really feel like they should be coming into the office. And now more than ever, we're aware that, right, it's better for sick patients to stay home. And so either I will come visit them at home, and now, of course, everybody's aware of telemedicine, but direct primary care has actually offered telemedicine all along. It's existed for 10 years or so. There are about 1,200 direct primary care offices around the nation, serving at least 250,000 of Americans. And so, we offer that here in the Hudson Valley, and I'm really excited about doing that more and more, and really creating awareness of a different healthcare model where patients are happier, doctors are happier, and we have a great lasting relationship, a trusting relationship that I really want for patients to feel that they can have with their primary care doctor. We're in this together to get everybody healthier, but it takes time, it takes trust, right? And so yeah, there's a lot of flexibility with being able to have these memberships, because we are not limited by what insurance companies dictate. But like I mentioned earlier, by taking out that third-party payer, then, we have a direct relationship with our patients, and, we can really have a lot more flexibility in how we go about taking care of patient care. So text messaging is available, phone call visits. The patient doesn't always have to come in to see me. We can take care of things over the phone now, over telemedicine, of course. More people are wanting to do that, and it's available. But at the comfort of their home, it doesn't always have to be an in-person visit to see your primary doctor. And so
I can see, like, tell us a little bit what you think about this. Well, clearly people can't come to the office right now because of what we're going through. So I'm sure there's an uptick in the telemedicine world. But I think now, because of this push to stay home, and people are taking more advantage of the telemedicine and getting, I think, maybe much more comfortable doing it. I know, like I was mentioning off air to you, that I see people posting on Facebook, that they can't sleep, or how many of you are having insomnia, or how many. So everybody's like kind of polling each other and doing surveys on Facebook about their health and their mental health and their emotional health, right? So knowing that there is this telemedicine, that there is this way to communicate with their doctor, I think is important, so that they can get assistance and advice from a professional versus a poll on Facebook.
Right. And it's been a really wonderful thing to see that now, all insurance companies are open to offering telemedicine to their members, and really making that available for physician offices to offer it. But It's been really wonderful because, most patients that want to discuss anxiety or depression, they want to really do that at the comfort of their home. It's really very difficult for them to, even start talking about it. And then, you bring the element of being in the office, maybe other people that might see them, especially in a small community, that just adds to the fear factor, right, of wanting to talk about, something as important as anxiety or depression. But now with telemedicine, yes, yeah, I'm really seeing that, patients are more comfortable with mentioning it and, wanting to have that conversation at the comfort of their home. And it's been really wonderful to see, them bringing up the conversation. And of course, I'm happy to then, discuss it and really, take that approach of, the whole, let's talk about lifestyle. Let's talk about, how long has this been going on? Not just, right, prescription medication is going to solve your problems, because that's really not the approach that I like to take. And my patients know that. And, I really do think that we can get better results when we address, the whole mind, the whole body, what's going on, in their social life, what's really going on, how long has this been going on? We have the time to review all of that over a telemedicine visit. Yeah.
We have a lot of course, with coronavirus and everything that's going on, the uncertainty, the fear is causing a lot of anxiety, depression, loneliness, also sleeplessness, insomnia. There are people that just their internal clock is totally out of whack,
Mhm.
and that can also lead to getting sick, because now your body is just dealing with so many different things. What are some of the things that you would offer as advice or suggest to people that might be dealing with some of these symptoms? Some things that they can probably work towards so that they can, I don't know, I guess, start healing from this process.
Yeah, yeah. I'm glad you're mentioning that, because I am encouraging a lot of my patients that are bringing it up, to really take advantage of this time that we are on pause, to really evaluate, what bad habits have we developed when we had really busy lives, and what were we ignoring, and that whole body approach, is why I mentioned it. I think it's really important to kind of, peel the onion, layer by layer, and let's talk about, for instance, like, having that internal dialogue. What does that sound like, right? Was it a lot of, really negative thoughts, right, that then affect the way that they feel? How can we turn that around and, focus on gratitude, right? That's a big thing that we're seeing now with mental health, or the approach of mental health. Let's turn that internal dialogue into positive thoughts. Or how can we turn the mind off at night? That's important, right? And there's so many things that can be done besides just, medications. So, exercise is important. Now that we have the time, can we take, 20, 30 minutes every day to either do some exercise at home? There's plenty of videos, even if it's just stretching, Pilates, or, can we take the time to go out for a walk with our kids, and start really working on developing better lifestyle habits, is really where I'm really trying to, encourage patients to take the time now. Because yes, I think that now that we've had to slow down, and, financially some people are struggling, and so, how do we turn all those thoughts off? How do we slow it down? How do we process all of that information, and without it giving us physical symptoms? Because if we don't really, watch how our mind is processing the information, it will definitely affect the way we feel physically. Healthy diet is important. The typical American diet, lacks in the B vitamins, D vitamins, omega-3 fatty acids. Those are the vitamins that our body needs to produce the happy hormones, right? Serotonin, everybody knows serotonin is the happy hormone. There's other neurotransmitters like serotonin that our brain depends on, but we have to give it the right materials so that our brain can produce those hormones, right? I talk about mindfulness. That's important right now. We're so used to multitasking, which it's kind of become our second nature, but it's actually very detrimental for our brain. I actually put a podcast on my Facebook page of a psychologist interviewing a surgeon at Cleveland Clinic. And she was saying that, there was a study at NYU that was done of Buddhist monks that they, mindfulness is their thing. They focus on one thing for a long time. And it actually turns out that, the research shows that they don't suffer from anxiety. They don't suffer from depression. They don't have these addictive behaviors that, we see in the typical American society. And so, it goes to show that actually practicing mindfulness, even if it's just 10 minutes a day, we have the time to do that now and really, try to develop good habits is what I'm really encouraging everybody to do.
Focus on one thing versus the 20 things that are going in my brain right now.
Because think about it like a computer, right? If we have like 10 different windows open, it actually does slow down the computer. And that's the exact same way our brain works. We are so used to, dealing with 10 different things, but it actually makes our brain very inefficient. But it also just, adds to the way that we feel, by creating anxiety and, all these different symptoms that patients have.
Yeah, you almost feel like you feel very anxious because you feel like you have so much that you have to get done or so much that you should be getting done. And even with this time of pause, you almost feel guilty pausing because you almost feel like I should be getting up my regular time. I should be doing what I am doing. I should be, I should be working on this and I should be working on that. And, I tell people, you can work on all these things, but sometimes it's okay to give yourself a break.
Yeah.
It's okay to just stop for a second and just relax and enjoy the day, enjoy that cup of coffee and get the work done, because for some of us there's like no stopping, but we can slow down the pace a little bit because we're in the rush to go nowhere right now. Right? So it's like, let's take our time to kind of reevaluate what we're doing. Let's talk a little bit about something fun. I recently saw your video that you have out about DPC, and it's a really cute, I think it's a great video. So tell us a little bit about that video.
Yeah, so we thought, what a better way to, really show the communities how, direct primary care actually can help families. And so, we kind of broke it down into a little cartoon of, someone that is sick either on vacation or in the office, and they need to have access to a doctor. And so it kind of shows, different aspects or how flexible direct primary care is, by having telemedicine as an option for visits, right? If someone is on vacation or if someone's in their office and they need to access their doctor, they can just schedule an appointment, access me as their primary care doctor, and we can then discuss, whatever they're dealing with. And so, the membership model, right, which is that monthly membership fee that the patient and the doctor contract, and that allows to have the patient unlimited access to me. If it's via phone call, text messaging, they can schedule telemedicine visits. And so I thought that video really just brings that home of, you have the doctor just a phone call away. And that's what that, direct primary care model actually, is supposed to help with, is access to care, right? Primary care doctors really want our patients to feel that they have access to us, and then if they do have to come in, if we need to take a look at something, then of course we'll have them come in in person, but there's so much we can do without having the patient come in to see us, and, it being flexible for their schedule, and not limit their ability to come. What else was mentioned in the video? What did you like about the video?
I thought it was a very clear message, and I think it just you follow through and you go, oh, okay, it was just a very clear and message about what the services that you provide at WeCare Medical. And I think that what triggered me was the fact that I know for a lot of my members that are small businesses, the affordability
Yeah.
and the fact that they're very busy. So also the access,
Right.
and how important that is to them, knowing that they can still take care of themselves and still run their business and not feel like they have to stop their business in order to take care of themselves. It's just
Right.
having that the access, the affordability, and the convenience
Right.
of it all. And I think it's a great message to put out in a very positive way. So it's not like you need to see the doctor. It's kind of, you can see the doctor. And so I think it just kind of had a different vibe to it. I want people that are businesses and even individuals to visit your website, WeCareMedOffice.com, so that they can learn more about the program and the membership model that you have for businesses, in case they're interested in either for themselves or something that they can put together for their employee as a package that would be much more affordable to them. Because I know it's sometimes a little bit difficult to provide this kind of service, even for themselves and their own family. A lot of times you're thinking about, how can I afford medical care with all the crippling costs of co-pays and there's some copay you have to pay, $2,000 in copay before the insurance will even start paying for your medical bills. So it's just one of those situations where I know a lot of people that go without just because they feel that they can't afford medical insurance. So WeCareMedOffice.com. Here's the number if you want to give a call. Do I have that in there right? 845-505-6212. And you are actually located in Pine Bush, although now you're doing the telemedicine. You're not seeing anyone at the office, are you?
Only rare cases, but I still have the office available for patients, for well patients that need to be seen. For sick patients, we're encouraging telemedicine as much as possible.
So go to the office. You can go onto their website and learn more about the program that's available through WeCare. So, Doctor, before we go, if there is one piece of advice, just something that you want those that are watching to walk away with today, what would that be?
Well, we are offering the memberships, obviously, right, as I mentioned, for either businesses, individuals, families, but anyone who really is having a hard time accessing their doctor and they don't want to commit to the membership. Right now, we are making telemedicine available to everybody, not just members, for $49 a visit. And so, that's been helping out, some that really feel like they haven't been able to access their doctor because they're either closed or there's, long waits until they can be seen in the office. So, that's my contribution to, the Hudson Valley, to just make myself available via telemedicine, even if it's just a one-time visit, one sick visit that they need, and they don't want to, look into, or at this moment, they're kind of on the fence, right, if they should be members or not. That's good. One good way of trying out, how this telemedicine works, but also, we can meet and discuss also the other options and look into memberships. But yes, definitely, we're taking new patients and we're happy to help out in any way that we can.
And I think it's sometimes for a lot of people, for the cost of $50, that is a great price for peace of mind.
Yeah.
When you're unsure and you don't want to you're anxious because you don't really want to have to go to the doctor's office or to ORMC or any of those places because you're scared, but you still don't feel well. And you're just like, So this is a great way to just get some medical attention without having to, and get that peace of mind. So again, go to WeCareMedOffice.com. I'll give the number one more time here. Dr. Ericka Valenzuela, thank you so much for hanging out with me today. And I encourage everyone, if they want to learn more about what you offer, to visit you and follow on Facebook. Do you have Instagram?
Yep, it's WeCare Medical Office as well on Instagram.
All right. Well, thank you so much. I appreciate you hanging out with me today. Stay healthy, stay well.
You too.
And I hope to see you in person real soon when we do our roundtables and our breakfasts.
Sounds great. I look forward to that as well, Barbara. Thank you very much. Have a good day.
You too. Bye-bye.